Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 3, continuation with Patient Safety, Infection Control and Medication Safety, in the Chapter 28 on Infection Control Practices Part 4, we will be discussing on contact precautions, disinfection and sterilization. The two main areas that we will be discussing today is of contact precaution, disinfection and sterilization. And with respect to that, what are contact precautions? Contact precautions are applied for patients suspected or known to be colonized or infected with organisms that spread through direct contact with the patient or indirect contact with contaminated surfaces or items in the patient's environment. So what is the patient's environment? The patient's environment is the hospital. The patient's environment is a healthcare setting where the lot of the direct contact of the patient to a human who is infected or someone who is transmitting it, or with respect to indirect contact where the contact of the patient is with contaminated surface or a healthcare workers has contaminated through that surfaces to the patient. So what we need to do it as we need to prevent this. So transmission can occur through hand contact, skin to skin contact or during patient care activities. You may see most of the activities of the patients related to healthcare workers or procedures are mostly dealt with hand contact. And you need to emphasize that when you are teaching or when you are training your healthcare workers actually that you need to have more emphasis on hand washing and infection control protocol with respect to hand. Skin to skin contact or during patient care activities that you need to emphasize that they require touching the patient, their skin or contaminated items around them before that they need to wash their hands and even after that. Precautions to follow is implement a standard precautions. The standard precautions across the healthcare setting and hospitals need to be followed by every healthcare employee. People who are there at the sharp end to the patient, particularly the nurses, they need to emphasize to their staff and give a specialized training with respect to implementing the standard precautions. The patient should be placed in a single room and they may be cohorted with another patient who are infected with the same pathogen. And if required actually you may find the patient need to be discussed actually about this. Why? If the patient is saying some restrictions with respect to infected patients or even being staying alone, you need to emphasize on that. Patient placement should consider the epidemiology of the organism where you need to emphasize on the hospital epidemiology. What are the numbers of the patient with the specific infection? What are the number of the patients actually who require such type of precautions actually? And with respect to the vulnerability of the patient population, your hospital needs to take this decision. The next line discussion would be clean and non-sterile glove must be worn whenever entering the patient's room, which is very important for every healthcare worker to understand this. A clean, non-sterile gown should be worn when entering the room if substantial contact with the patient or potentially contaminated environmental surfaces is expected. The movement and transport of the patient should be restricted or strictly limited to an extent. If at all it is done, they should be shifted only for essential purposes. There should be a dedicated separate lift or transport actually area where designated signage is actually that the movement of the patient is done through this route. If transportation is required, appropriate precautions must be taken to minimize the risk of spreading the infection, where the patient need not to touch the different surfaces actually while transporting. Draining wounds on the patient must be covered with a cleaning and secure dressing, which is very important that the patient should not get the infection or the patient should not transmit the infection. Then comes contact transmitted diseases, which includes which are caused by multiple antibiotic resistance organism. MDR-TB can be one among the commonest example that we can say which is more transmitted. Enteric infections and various skin infections can be the best example to be cited in contact transmitted diseases. In discussion with disinfection and sterilization. So disinfection and sterilizations we will study in detail in this section. The Center for Disease Control, that is CDC, the guidelines for disinfection and sterilization in healthcare facilities were developed in 2008. And CDC is recognized internationally, but Indian hospitals may require modification due to financial limitations and high patient load, which are usually being seen as a major constraints for Indian hospital to follow these guidelines. So Indian hospitals needs to modify and develop their own guidelines, which can be seen at national level. Differences in implementations are expected because of multi-centric trials in India, which are very limited. And it should be highlighting the need for customized guidelines for Indian healthcare settings, especially public hospitals. So, Splotting's classification categorizes disinfection as higher level of critical items, intermediate level for semi-critical items, and low level for non-critical items. So these three distinguishing as high level, intermediate level and semi-critical items, and lastly as low level for non-critical items. The importance of following recommended disinfection practices has increased due to rising healthcare associated infections. It has been seen from the world data that is an alarming sign that healthcare associated are being counted as one among the major cause of death for the patients. Surface infection. Very importantly, where I need to emphasize more on that case surface infection plays a major role. So disinfection and sterilization with respect to the protocols which has to be developed need to see surface infection as one among the areas where you can collect the sample, you can work on that and the data will help you actually to improve or increase your sterilization and disinfection practices. Environmental surfaces such as bedside tables can contribute to cross transmission through contamination from healthcare personnel, medical equipments, or even the patients. So, both disinfectants and detergents may be used for non critical surfaces, but the debate on their necessity for every situation remains unresolved. Now, the discussion with respect to potable water, environment and terminal disinfection. So, potable water must always be used in kitchen areas because fecal oral transmission can cause food poisoning and outbreaks. And we have witnessed so many incidences which are being reported specifically due to this issue. Reverse osmosis or treated water should be used for all drinking and cooking related purposes. Storage tanks for water must be cleaned regularly to ensure safe water availability. For every healthcare organization, this is a very important task to see with respect to the non-clinical people to emphasize actually and see that how this really affects the entire organization. Treated water should be used to wash utensils and prepare food. And proper temperature maintenance for milk and food items is crucial for kitchen safety. This is more a topic which is dwelling towards support services, but it is very important that departments of support services like CSSD and even kitchen can be seen as major source of contributing infection. Environmental sanitation must be maintained consistently, especially floors and washrooms, which should be cleaned with soap, water and suitable disinfectant. Terminal disinfection of isolation rooms and operating room should be performed using fogging agents like incinerators and hydrogen peroxide. Formalin fumigation should be encouraged at any stage when it is a case of disinfection. Now we will be discussing more on management of spills. Spill management must strictly follow the OSHA blood-borne pathogen standards of 1977. So this is more towards the Occupational Safety Health Administration guidelines actually, which are giving us, and they have developed the blood-borne pathogen standards in 1997. With respect to that, it emphasizes that for small spills less than 10 ml and intermediate level germicide registered with EPA. This is an agency which is more working towards the environment precaution, which is an US based agency which registers actually to certify and give that what are the germicides to be used, which are to be more effective against HIV and HBV, which is must be used. If sodium hypochlorite is selected, a 1:100 dilution should be prepared. The next is for large spill, sodium hypochlorite in a 1:10 dilution is preferred to ensure higher disinfecting capacity. So you may say with respect to higher versus lower, you need to work on the spill, where the spill can sometimes be a small spill, sometimes the spill can be even a large spill. What are the audits for this part? Or do we need to emphasize more on the audits? Yes, we need to emphasize and conduct the audits. So hospital must provide adequate facilities, supplies and up-to-date training for healthcare workers to promote safety and infection control. A strong institutional culture supporting safe practices and infection prevention is essential. Regular audits of hand hygiene practices help monitoring compliance and identify the gaps, where you can do RCA or you can even work on the doing a PDCA actually if you find that there are lapses actually into the hand hygiene practices among your healthcare workers, where a strong leadership can emphasize to develop a role actually to the administrators who need to work strongly on institutional culture supporting safe practices and infection prevention, which is very essential, rather not just putting a blame culture. Healthcare workers should encouraged to provide inputs and feedback regarding the areas of needing improvement, where many times it is being seen that when most of the time the healthcare workers are saying about their uses, or even they are trying to give their feedbacks related to certain equipments or even instruments, or sometimes even their practices, they are not encouraged. So you need to encourage as a quality team actually to work with them and to give them insights actually about their understandings actually. Visible reminders in critical areas especially, which helps enforcing them training and maintaining consistent infection control behavior, which is very critical for most of the employees actually, that they can do a lot of mistakes in these critical areas. So this is a display of contact precaution and disinfection protocol, where you can see in the first picture what are the contact precautions while taking it, where direct and indirect contact risk is being displayed. In the second picture, we can see the surface and terminal disinfection, which is like cleaning surfaces and fogging agents actually should be used properly. In the third, where the spill management, we have discussed that you should use an EPA registered germicide, which is very important when it is more a concern of environment protection. This can be even applicable to other industries who are closely facing spill management issues like what we are facing in healthcare. And no doubt actually we need to see the audits and the quality culture. Regular audits and feedbacks from the employees, encouraging them on working on this, taking more emphasis on understanding the gaps, improving on the daily practices, which can be seen as a quality journey which is taken regularly, and need to maintain the data to work on this, with respect to the contact precautions and disinfection protocol. So in summary to this chapter on contact precaution and disinfection and sterilization, I would like to say that when you have to prevent infection, especially HAIs, which are spreading through direct or indirect contact by using gloves, by using gowns or single room placement and restricting patient movements. So you may see that contact precautions are one which we can do it. It can be seen as a culture, rather not investing so much of money, but yes, it can be seen as a process oriented. So the outcomes of would be like more in reduction of infections. You will see the success in the quality team on only working on this will give a great success. This can be seen as one of the element of working on that part. Disinfection and sterilization practices followed by Splodding's classification and must be adopted to India's high patient load and resource constrained institutions, where you need to see that these are the one and the very major foundation actually for infection control, that if you are following or adopting, your hospitals is taking a huge stand on this, definitely it would be benefiting actually for the institutions who are really working actually to reduce the infection. We see most hospitals in India are having a high patient load and resource constraints. So you cannot see that quality can compromise only because of this, but increasing in amount of the efforts with respect to infection and working on sterilization and disinfection practices would definitely reduce the load of infection to our Indian healthcare institutions. Environment and surface disinfection. We need to see that the practices actually that with respect to environment and surface disinfection is very important when you find that the external environment has a strong effect on developing more chances of infection or breeding infections in your hospitals. So this reduces, if you're working on the environment and surface disinfection practices, which reduces the cross transmission by ensuring regular cleaning of surface, which is more done by your housekeeping staff. Your housekeeping staff need to be trained for that part, which can be seen as an on job or can be seen as a regular, which can be encouraged through motivating them, giving more emphasis on the improvement actually in their practices rather not on a blame culture. Potable water safety is one to be emphasized, and proper sanitation procedures need to be followed when there is cleaning and thing is done. Terminal disinfection. Terminal disinfection of isolation operating room is done using hydrogen peroxide. This is a very important when you have to scrub a superbug, or sometimes you may find a particular ward or particular room or even a particular zone of your hospital is being suspected that it is developing a huge load of HIs. And to scrub them, you need to see that you use always hydrogen peroxide or fogging agents, which are to be dedicatedly being seen in proper proportion, while formalin fumigation is discouraged. Lastly, with respect to spill management, which involves using appropriate dilutions of sodium hypochlorite depending on the spill size, that can be small or large, as per the OSHA health standards, that is Occupational Safety Health Administration standards, which are one to give you more reasons to think that how your organization can work more better. So with this, I would come and end to this chapter, where you can take the help of these references to develop your project with respect to this infection control practices, and make see that whatever protocols that your hospital is following, you can add and make it more better working space. So thank you for patience listening.